Africa. He received his medical degree from Olabisi Onabanjo University, Nigeria, and his postgraduate medical degree in public health from the Yale University School of Public Health, where he focused on healthcare financing, policy, and management. His career spans medical operations, policy analysis, and healthcare insurance management. Dr. Ali embodies a steadfast commitment to revolutionizing healthcare accessibility, affordability, and quality. His major areas of interest include universal healthcare coverage and developing sustainable healthcare delivery model. He is an alumnus of the Global Health Delivery Program, Harvard School of Public Health, and the Executive Program at INSEAD Business School. He's a member of Chartered Insurance Institute of London, the Royal Society of Public Health, American Quality Society, and the Medical and Dental Council of Nigeria. He has a rich tapestry of academic achievements, professional accolades, and steadfast commitment to societal impact. He stands as a paragon of excellence, shaping the future of healthcare in Nigeria and beyond. Please join me to welcome Dr. Olatokunbo Ali to have the microphone to take the first presentation. Thank you.
Thank you very much, Mr. Fulabi, Mr. Obe. Thank you so much. It's indeed a pleasure to be in our midst today, to be discussing revolutionizing patient care. Good afternoon, everyone, once again. If I may stand on existing protocols. Ladies and gentlemen, and esteemed colleagues on the call, it is indeed an honor to be discussing understanding patient-centric care as part of the broader discussion on revolutionizing patient care. Patient-centric care or patient-centered care is a topic that has been closest to my heart for a long time. And when I got this invitation, I was excited to, add my own 2 pence to the conversation. I'd like to discuss or define patient-centered care as we know it, and also talk about the future of patient-centered care, patient-centric care. What we're doing now, what we understood it, the way we understood it previously, what we're doing now, and the future, what the future portends for us. In today's healthcare landscape, the concept of patient-centered care has emerged as a guiding principle reshaping how we approach the delivery of healthcare services. It is imperative that as healthcare professionals, we actively incorporate these principles into our daily practice. There's something that I've always talked about and preached about. We hear it a lot, but how much do we practice it? And that is the topic of, or the item called the customer journey, or the patient journey, or the patient experience. We say this a lot like a buzzword, but how many of us actually try to sit down, map it in our various healthcare organizations, and see how we can increase or better measure the experience level of our patients, our customers, as we know them? There's 2 things. There's a journey. The journey begins when the patient decides to seek healthcare at your organization or any other healthcare facility, and the next part is the experience. What is the patient's experience throughout that entire journey? And for me, the way I'd like to take this topic is really about some basic tenets, and to keep it very simple, I like to talk about trust. Trust and transparency. If you don't remember anything we talked about, remember trust and transparency. They're 2 important words that can shape this patient journey or patient experience. Putting that back of your mind and understanding that we must put the customer or the patient at the center of everything that we do, center of our value chain, that gives us the that builds the level of trust within our customers or our patients, that would help us to deliver better service, more excellent service, that we can certainly define as patient-centered or patient-centric care. So remember, we must put the patient front and center of everything we're doing, or the customer, you know. And the way to go about that is, one, putting yourself in that patient's shoes or the customer's shoes, and two, making sure you're building trust. Trust and transparency is a huge foundation to ensuring that we can deliver care that is centered around the patient. So, what's a patient-centered care? At the heart of patient-centered care lies effective and empathic communication. As healthcare providers, sometimes we forget that the patients in front of us are anxious, and they're worried about their healthcare. So we must make sure that our communication is as clear as possible. We're not ambiguous about what we're dealing with, or how long it will take. For example, let's say a patient walks into Sin Lab to have a particular test. We need to be clear and ambiguous about how long it will take, how much blood you're going to take from the patient is going to feel any pain, when the first samples will come out. That level of clear, unambiguousness, empathic communication, it helps to go a long way in putting the patient at the front and center of trying to care or manage that patient. You know, how we communicate with patient is usually sets the tone for the entire healthcare journey. So you see, the first time you're meeting the patient is anxious, probably doesn't know you. I just walked into your facility, and he is has come in there because he's in need of help. So your reception, the person who the patient meets the first time, the first doctor, the first front desk officer, the first lab person, the first nurse that take the vitals, is very important, because this actually sets the tone for the entire journey. Remember, I mentioned in the beginning, we're talking about the patient journey, and as well as the experience along that journey. So that reception sets the tone. Then we talk about you think about the patient as he has come into this healthcare value chain in order to seek help and care, but also know much about it. So consider yourself as the patient's GPS. So you're like the guiding light that will lead the patient to the outcome that the patient seeks, which is healing, and full recovery from whatever ailment has brought the patient either to a hospital, wellness center, or lab. Your duty bound to guide the patient through a maze of all the medical jargons, and help connect with them better. So as much as possible, I tell people all the time, try to always keep it as simple as ABC. You must try to explain to your patients as if you're talking to a 5-year-old. Keep it as simple as possible, so that this patient is really anxious. The patient understands you better and has a lot more comfort when the patient leaves your front door. Open communication is also very important. It's the cornerstone of patient provider relationship. You must be very open as much as possible. You don't keep anything from the patient. You must gauge the patient's ability to take bad news, and then be as open as possible with the patient. It serves as the foundation upon which trust and understanding are built. When we communicate with empathy, we convey to our patients that we see them as individuals, not just cases or conditions. So it's very, very important. I mentioned earlier, for us to communicate with empathy. I always tell people something: put yourself in the shoes of that patient. Put yourself in the shoes of the patient who has just gotten a cancer diagnosis and needs to come and do at your lab. How does that patient feel? So be very, very empathic about it. In fact, I tell my staff at times, pray with the patient if you have to. Because that is you being patient centered and ensuring that you're putting the patient front and center. I can't overemphasize the essence of building trust. You must build trust. You must become your patient's best friend. In order for you to define and revolutionize healthcare, your patients must have complete trust in you, even more than their family members. And it's not, they say trust is not, you don't just get trust, you have to earn it. Trust is not merely earned, it's cultivated through a genuine connection and consistent actions. as a healthcare professional, it's important that we listen attentively, validate your customers' consent. Very important. Validate their consent and demonstrate a commitment to the patient's well-being. You do not, because you've seen 1,000 of them cases. Sometimes we were guilty of just assuming that the customer should know, or because we are so professional at what we do, we don't usually, we take it for granted that the customer doesn't know much. So when the customer is asking you questions, please do not weigh them off. Please validate their consent as much as possible. Make them that you understand the way they feel, and that this is what you're doing to make them feel better. Just like just like you want your friends to be honest with you. Our patients expect the same from us. Be as honest as possible. Put yourself in your shoes, like I said, and be as friendly as possible with them. Transparency is, like I said, trust and transparency. Put those two things down: trust and transparency, patient journey, patient experience along that journey. These are the things that lay the foundation and the bedrock that will lead us to next level patient care and revolutionizing the way we understand patients. So moving on, understanding that patient needs go beyond medical diagnosis. It requires a holistic approach that considers individuals' physical, emotion, and social um, dimensions. It's extremely important that we understand that each patient are unique and have their own set of beliefs. Especially in a country like ours where we have very religious inclinations. So we must understand that fact and understand that we must also walk along those lines to respect the patient's beliefs. I'm not sure how much time I have left, so I'd like to dive down into the next part, which is actually discussing the future of patients. I say something to people all the time. We're in the fourth industrial revolution, and I think we must all take advantage of it as early and as quickly as possible. Do not underestimate the power of artificial intelligence. Do not underestimate the power of machine learning. And how we can make use of them, make our lives easier, and allow us to actually revolutionize healthcare, putting the patient front and center. Take advantage of technology. Technology has done a long way to help us in a lot of our businesses, but now we must strive and learn to understand about AI. You know, understand large language models, understand machine learning. ChatGPT, I don't know how many of us on this call use it, but it's an extremely important tool that can reduce the amount of time we use to do work. I just saw something in the papers the other day. The first healthcare LLM model conference is holding this year, and I impressed at that. So that is a conference that is focused on healthcare and trying to build models like ChatGPT for healthcare. I saw something the other day as well where I think in India also they are testing an AI driven nurse, where the nurse does almost everything that the normal nurse can do and is AI driven. So there's a lot. I don't want us to discard it. I feel like this is the future, and this is how we can actually revolutionize patient-centered care as we go forward. You know, healthcare is going to be tailored to individual patients' specific needs, often referred to as precision medicine or personalized medicine. This approach takes a granular look at individual patients and considers the unique genetic, environmental, and lifestyle factors to guide decisions. So we're getting there where each unique customer will have his own unique medication, his own unique diabetes or hypertension. And guess what? With the way precision medicine is going, it's not going to come at a cost. It will eventually reduce the cost across broad and make it more affordable for everyone. Personalized medicine treatment and recommendations are highly individualized, potentially leading to more effective outcomes, fewer side effects, and improved patient care. Some of you might think that it might be expensive and almost impossible to achieve, but like I said, the truth is that we're now in a data-driven industrial revolution, and we as healthcare professionals should not shy away from understanding and taking advantage of it. We must learn. It is extremely important that we learn. We learn new things. Don't just sit in our silos. Every day I'm trying to read something about AI or machine learning or what it's doing in healthcare and how you can improve my own business. Like they say, data is the new oil, and we must take advantage of it as we speak. So some of the things I like to talk about, touch briefly. You can decide to read more about them because I think I'm almost out of time. We need to talk about integration of AI and machine learning. Extremely important. How AI and machine learning can transform patient care by enhancing diagnostic accuracy, personalized treatment, and predicting patient outcomes. Very, very important. Telemedicine. We saw the rise of telemedicine in COVID. It has gone down a bit now, but I think we need to take advantage of it, especially in a country like us where we have a lot of rural areas and no access to doctors. We can set up structures where we can extend telemedicine into those remote and underserved areas of Nigeria. Telemedicine can improve access to specialists. The jackpot syndrome now, how we don't have too many specialists in Nigeria again. They're just a number, they're like a handful. We can see how we can make things easier for these doctors and increase access to these specialists via telemedicine. Another important thing that has come our way, but we do not really understand how much it has impacted us, is electronic medical records. 10 years ago, we could count the amount of hospitals who were using this, but today almost 90% of the hospitals all have electronic medical records. They've seen the effects, they've seen how it can increase efficiency and effectiveness of delivering healthcare. You've seen how it can reduce the mistakes. Some of these EMRs out there today are AI driven in such a way that it will even pick and tell you when a number is off, or compare across a period in time, the values of a particular individual, and it can tell you when it was high, when it was low. You know, the advent of wearable technologies as well. It is important that we begin to see wearables that can check pulse, check blood pressure, and check other indicators of life that can actually help insurers as well as medical people manage their patients better. I talked about blockchain, very important. That's why I said people, please learn about it. Blockchain in healthcare has been making significant strides in recent times. Please, let's not be left behind. See how it can help you in individual businesses. It can help with transparency. It can help to enhance interoperability between businesses, between HMO, healthcare provider, laboratory services, as well as diagnostic centers. We can securely transfer patient records via blockchain. Talked about precision medicine. Talked about healthcare, robotics, artificial intelligence in mental health, also innovative methods in healthcare financing, and beyond all, it can help to also guide and regulate our industry. So please, like I said, technology, fourth natural revolution, please don't forget about it. Let's see how much you can learn. Go back, unlearn what you have learned before, and take up what is new that can make sure that we can achieve our goal of eventually revolutionizing healthcare and delivering superior quality services to our customers, putting them at the front and center. Thank you very much.
Right. Thank you so very much, Dr. Olatokunbo Ali, for your presentation. Thank you for the various areas you have focused on. I am sure we have learned so much about having a customer-centric approach in all we do, regardless of our positions or our duty within the healthcare space. You have also made us to realize that we need to shift away from the conventional doctors, nurses, or healthcare professional knows it all mentality to an area where we need to understand our patients, communicate effectively with them in a very empathic way, making our conversations quite simple and in the very clear terms. And of course, that is enhance the trust that this our clients will have in us. And you also talk extensively about employing artificial intelligence, to help us to revolutionize the healthcare practice in our space. We want to, again, very much thank you for your time. And we're going to be moving on to the next presenter now. And Our next presenter is Dr. Tinuola Akimbolagbe, who is the MD, CEO of the Private Sector Health Alliance of Nigeria, an organization which leverages the capabilities, assets, and resources of the private sector to drive improvements in Nigerians' health outcomes and achieve the universal health coverage. She's experienced, highly collaborative team player with relevant board level experience and a demonstrable track record in the health and allied sector. She's an healthcare administrator with over 2 decades of experience spanning across clinical medicine, health care services, health insurance, information technology in healthcare, and healthcare diagnostics and non-profit sector. She holds a degree in medicine and surgery from the prestigious College of Medicine, University of Lagos, and a postgraduate degree in public health from the London School of Hygiene and Tropical Medicine, University of London. She's actively involved in mentoring students and young professionals and works with several charities and non-profit organizations to raise funds for community healthcare initiatives. Kindly join me to welcome our second presenter, Dr. Tinuola Akimbolagbe. You have the floor, ma'am.
Thank you, Dr. Obey. It's great to be here. I'm delighted to be featuring on the quarterly SynLab webinar. I'm glad to be going after Dr. Tukumbo. I'm also happy to be representing all women because this is our month, and I'm the only woman on this panel. So till the end of the month, this month is for all women. My topic today is collaborative care and patient empowerment, and I think these are very important topics in Nigeria right now and then generally in the world. The subtopic I have is interdisciplinary collaboration in providing holistic patient care and the strategies that we need to deploy to educate patients about their health conditions and empower them to actively participate in their care decisions, and then lastly, policy issues around patient care in Nigeria. So I actually broke up my topic into 3 areas. I'll start with interdisciplinary collaboration. So Nigeria's healthcare professionals cut across various cadres and various disciplines. You have a healthcare team that takes care of the patient, and it spans from the doctor, the nurse, in some cases, the pharmacist, physiotherapist, and health psychologist, and all of them attend to the patient's needs, which covers physical needs, mental needs, emotional and social needs. And you even have the social worker. You know, those are also cadres of healthcare workers. So we need to develop an integrated manner of working together so that we can have integrated treatment plans which can address all areas of the patient's needs, and then also have shared decision making. Unfortunately, in Nigeria, for many years, we've had this rivalry amongst various cadres of healthcare workers um, concerning who leads the healthcare team. I don't think it's necessarily a productive argument, because even though some people seem to make more decisions about the patient, you find that other cadres of workers that spend the most time with patients. So you have a patient on admission, for instance. Most of their communication is with the nurses, with the physiotherapists, with the various cadres, and they barely get to see the doctor. So I believe all parties contribute, and every party is important in the patient care decision making. We also need to ensure that we have a shared decision making. If you look at treatment plans, the doctor could come up with something. During the course of managing the patient, the nurse or the pharmacist could realize that there are drug interactions or that there are conditions that do not support the use of some of the prescriptions given. So it has to be a shared decision-making process. We also need to prioritize the continuity of care. So if you have a patient come in, for instance, in the emergency room, and it's handled by some professionals at that end, goes perhaps to the theater or to the ICU, is managed by another set of professionals, is on the ward, and then is discharged, but still comes in for rehabilitative care, physiotherapist, what have you. You have different cadres of healthcare workers working at various sets of that chain, and there must be continuity of care. There must be adequate decision making. There must be collaboration so that we can achieve our desired objective, which is a good patient health outcome. Also very important, health education and promotion. When we say collaboration, we're not just speaking to collaboration within the cadre of the healthcare workers, but even within the community, looking at their family members, looking at traditional leaders, faith leaders. Religious institutions are very powerful in Nigeria. We have people that are very focused on their faith, and until their pastor or their imam tells them to do something or support the decision, they're not going to do it. So for you to have better adherence to your management plans, it's good to have community influencers help to raise awareness and promote healthy behaviors. So now speaking to education of the patient, in Nigeria, we have such a wide gamut of people. We have very diverse cultural, linguistic, and socioeconomic context. So for us to have an effective patient education strategy, it must be tailored to the specific needs of the population that we find. A lot of times, patients speak English, but their understanding may be limited. So there are occasions where you actually have to translate to their primary language just for better understanding, or even to pidgin English, which is a universal lingua across Nigeria. But some of the things that we emphasize is, regardless of the language that you're using, it must be simple, easy to understand sentences. As Dr. Ali said, we tend to focus a lot on medical jargon and use terminologies that are not in the patient's everyday language. So for them to comprehend, to have a true understanding of what it is that you're saying, you have to use everyday, easy to understand language. Interactive education also. You have a lot of role-playing demonstrations and visual aids. You find a lot of times when you go to the hospitals, you see these colorful images on the wall showing the disease patterns. It's all in a bid to help to aid the patient's understanding of the disease process and help them to participate and also retain some of the information that we share. Very important in our environment is cultural sensitivity. There are a lot of things, cultural beliefs, values, practices that you have to cater to in order for your treatment to be effective. So in some places, you can't see a female patient as a male doctor. You need to have a female attending to a female. There are other beliefs also around food and certain practices which you must understand and work around them such that your efforts are not rebuffed. So you have to include the community leaders, religious institutions, local institutions to help to promote a sense of ownership and help them to identify with the message that you're sharing. Also to regularly follow up with the patient. One thing we found very successful in Nigeria is the group approach. So you have people go into communities and they have these community meetings where they have all the leaders, all the women, community leaders come together. We do that a lot for antenatal care in the community. So they sing, they dance, it's something that is familiar to them. And then you can introduce information about things like eating well, habits to, or practices to stop, which could put both the mother and the child, at a disadvantage. So also, I want to speak about empowering patients. Now, that's different from patient education. And in this time, we find patients' rights are not always taken very seriously. So apart from the patient's education and literacy, you also have to look at shared decision making. So when you collaborate with the patient and you understand their own goals and their priorities, if a patient is not in sync with you, you're working at cross purposes. No matter what you do, they won't get better. But if you understand what it is that is driving them, their goals, their principles, their background, and you encourage feedback, then you can give them a treatment plan and then take their feedback on what works for them, what choices they prefer, their values, and have their input. When you have this and their concerns are validated, then the chances of them adhering to your treatment plan are much higher. Also try and involve the families, the caregivers, and patient support and advocacy groups. In Nigeria, family plays a huge part of healthcare decisions. For children, you find that women are the primary caregivers, the mothers. In some instances where the mother is not listed, you find the father coming as well. So you need the patient to bring in a trusted individual to your appointment and then involve them in these discussions, of course, with patient consent. You must have informed consent. There's so many challenges across handling patients. And so being culturally competent and sensitive can help to bridge some of those hurdles. Then speaking about policy issues in Nigeria concerning patient care, we have a number of challenges. Some of our policy issues, I believe as far back as 2006, the National Health Promotion Policy, NHPP, was developed by the Nigeria government. But the implementation has been quite poor. We have weak intersectoral collaboration, weak management structures, and limited understanding of the of patients' rights and consumer rights at all levels. Some of the policy issues that concern patient care include healthcare financing. We've never managed as a nation to reach the 15% set aside in the Abuja Declaration. I know a few states in the north, I think 3 or 4 states, managed to reach 14 or 15% in the last 2 years. But when you look at the size of their GDP, it's not significant. It's not that substantial. So as a nation, we should look to hitting that. Lagos State can be commended. I know Lagos State achieved 10%, I think about 2 or 3 years ago, and they committed to increasing that by 1% every year. But because of that, we have such widely varying commitment levels across the nation. So there's a varied picture. We don't have something that is uniform. But when you look at it on a national basis, it comes to about 5% of the GDP that goes to health. So you have a lot of out of pocket payments, and that doesn't really help people. It doesn't improve health seeking behavior because people don't go to the hospital when they need to or go and access care because they can't afford to pay for it. So we need to increase accountability, transparency frameworks, and expand the health insurance coverage. Interestingly, the current health administration leadership, the minister has spoken extensively about their drive to increase and expand health insurance coverage nationwide. And so we look forward to some of the steps that they would like to unfold and how that would be achieved. Also, healthcare infrastructure, it's inadequate. Looking at the number of people that we have in Nigeria, our healthcare infrastructure is far below what it is that we need. Now, healthcare infrastructure is usually pretty expensive. Procurement of medical equipment, supplies, and so we advocate for more PPPs where the private sector can be involved in purchasing or supplying some of these equipment, and then they have access to markets through the public structures. And then, there's a shared list of responsibilities who does what. Also, healthcare workforce development. As Dr. Lee said earlier as well, we have what we call JAPA syndrome. Doctors are underpaid, nurses are underpaid, medical laboratory staff are underpaid, health information workers are underpaid, and all these tend to compromise the quality and accessibility of the healthcare services. Midwives. So policy makers need to implement strategies to address these shortages. There are a few states, I believe Delta State, and I think I heard on the news yesterday that River State is also looking to expand their training capacity for producing more healthcare workers. But they also need to improve the working conditions and incentivize rural services. We find out that most healthcare workers prefer to stay in the developed cities. So you have a concentration in Lagos, Abuja, and I think a little bit in the River State axis. But in rural areas, you don't have much of that. You need to promote tax shifting and tax sharing. And then look at ways to utilize technology. I'm glad Dr. Ali spoke quite a bit about that, so I won't belabor that. But that gives us the opportunity to leapfrog ahead. The same way mobile phones gave us the opportunity to achieve teledensity by not waiting for everybody to get a landline. Telehealth and the use of technology for healthcare service delivery can also give us that opportunity to get some form of universal health coverage, even without having boots on the ground in all locations. I'd like to also mention health information systems. We have the rudimentary health information system at best. Even though we have people using health information systems in the private sector, it's not as widespread in the public sector, where I dare say we actually may need it more. And therefore, it's difficult for us to be able to collate the health data, which would help to inform our decision making and help us to monitor health trends or emerging diseases and flag outcomes. I mean, it's getting better, but it's not at where it should be. Also, there should be some integration between the health information system in the public sector and in the private sector. I know with the enlisting of all Nigerians and monitoring, everybody now has to have NIN. It will be easier now, having those unique identifiers, to have some way of collating all the health data. But also, security of that data is critical. I know we have some policies, the Health Information Act and all that have recently been passed on how that data must be stored and who would have access to it. So those are some of the things. I think just two more points I'd like to speak on concerning patient care. One is quality of care. I know I'm running out of time. One is quality of care. Very important. We need to have standards to reduce medical errors. We need to have more regulatory oversight over healthcare facilities in the states, in the local government, and even at the federal level. And there needs to be sanctions, and regulatory bodies need to do more to monitor and evaluate the performance of healthcare delivery. So lastly, in conclusion, patients' rights and advocacy. We need to protect patients' rights. So it's slightly different. I know we have a consumer protection council in Nigeria, but there needs to be something that actually speaks directly to health. Because patients tend to face discrimination, abuse, and violation of their rights within the healthcare system. So there should be education on both sides so that the patient knows what is their right and the healthcare workers also know what they can do. So there should be informed consent, confidentiality, and dignity for all patients, and an avenue for them to redress any perceived grievances. Thank you.
Thank you so very much, Dr. Tinu, for your presentation. Dr. Tinu has taken us through within the last 20 minutes, where she has stressed the significance of interdisciplinary collaboration within the healthcare space, the need for us to move away from the parochial individualistic approach that has not helped us so much, and the need to develop integrated model to work together, stressing the importance of individual role in ensuring a good clinical outcome. She has also mentioned the need for us to understand environmental peculiarities vis-a-vis our spiritual leaders, community leaders, opinion leaders, to also understand our cultures, our religions, our belief system, and of course to design a model, that incorporates all of these, to ensure that we have a good clinical outcome. And again, she also mentioned the need for us to, get periodic and regular patient feedback, which could help us to improve our processes and to also, of course, as a country, to review our policies to reflect current global best practices and customer-centric approach. She also mentioned the need for information technology and artificial intelligence and regular disease surveillance, and the need to be data-driven. And of course, she also mentioned the need for us to standardize care in such that we're able to reduce our medical error. We want to particularly again thank you, Dr. Tinu, for your wonderful presentation. We're going to the third presenter now. And before we move on to that, I would want to appeal to us to please drop our questions on the chat box. I would also like to let us know that just before we round up this webinar session, a participant feedback form will be sent to us. Kindly ensure that you fill this. It will not take us more than 1 minute. And of course, this is part of the things that Dr. Tinu has mentioned, that could also help us to, review the processes in a way of achieving, a better presentation next time. So we're going to be moving on to our third presentation now. Thank you so very much, Dr. Tinu, for your time. Our top presenter is no other person than Kenneth Okoli, who is an experienced business leader in the healthcare sector with demonstrated background in medical diagnostic services. His skill sets include business process design, healthcare management, critical thinking and strategy, quality management, and change management. He is currently the Chief Executive Officer of SYNLAB Nigeria, which is the industry leader in medical laboratory services in West Africa. He has worked with other leading industry players in Nigeria. Kenneth Okoli is a member of the Forbes Business Council. He holds an executive MBA in Business Administration and Management, Strategy and Finance from INSEAD Business School. Kindly join me to welcome Kenneth Okoli for the presentation.
Hey, good afternoon, everyone. I think I'll be standing on all existing protocols. Please kindly confirm, just Dr. Bay, maybe you can confirm if you can see my screen.
Yes, your screen is up.
Oh, okay. I want to thank the speakers who went ahead of me. I think they've actually made the work easy for me. They've talked a lot about technology, so I would not be spending much time. But again, I think what I would dwell on is really bringing out use cases to show what is possible and also what most likely we're already doing in country. Of course, it's no news that in sub-Saharan Africa, where Nigeria is, we have some challenges. Dr. Tinu had mentioned the challenge with infrastructure, of which technology falls under the umbrella of infrastructure. But even with all of these limitations, it's important for us to know what is available in the entire universe, okay, so that we can also aspire towards something. And who knows, there may be someone on this call who is a budding entrepreneur who would pick up an idea from some of the things I would share, because researching this topic, I was wowed by the opportunities that are out there with regards to technology as relates to healthcare. All right. In starting off, sorry, one second. Yeah, I think we've seen digital transformation in healthcare. And I think we started seeing this really gain traction post-COVID. Okay. And we've seen that digital transformation in healthcare encompasses a wide array of within the healthcare space, from care delivery to health data management, which of course Dr. Ali talked about, which I will also maybe delve a bit deeper into, down to patient-provider interaction. We've seen advances in all of these areas, okay? And all of these advances are clearly shared in this space, where you've seen the rise of telemedicine, the use of big data, the use of mobile health apps, blockchain technology, which Dr. Ali mentioned also, 3D printing, virtual reality and augmented reality, which is used currently in improving the education of or in teaching in medical in schools in most of the developed world. We're also seeing the emphasis on cybersecurity and privacy enhancement for healthcare, and of course wearable devices. When I watched the speech by Tim Cook when they announced iPhone 15, and the way he described the use cases, the way they showed the use cases for wearable devices and how it was transforming healthcare. And when I did some research, I could see that companies like Apple are positioning themselves to become healthcare organizations, okay, because of the leverage or because of the expansion or the improvement in technology that we are seeing. But moving on from that, when we look at virtual technology, virtual healthcare, which is one thing that technology is helping us to achieve, I do not need to be in the same space with my patient again to be able to at least consult, at least offer some form of guidance to the patient. A patient does not need to walk into the laboratory. Again, there's some form of virtual aspect there to have his details collected, or for his results to be given to him, okay? Or for even him to be able to even make requests for tests. He doesn't need to leave the comfort of his home. Okay, and all of these are all under the influence of technology, all right? And a huge part of it has to do with making healthcare easily through virtual access. And this has some benefits. And what are some of the benefits? Of course, accessibility is one, efficiency is one, personalization is another one. Just imagine, take for instance, I don't know how many of us have had the opportunity to visit not a private hospital, a typical teaching hospital, and you want to see a doctor, even on appointment, you have to wait. Even in a private hospital, sometimes you need to wait some minutes, sometimes in some cases hours. Let's not add the bit of traffic you need to go through, especially if the hospital is far from you, okay? And oftentimes, all you're going to do is just to sit in front of the doctor to explain what is going wrong with you. He may not need to perform any form of physical check, and all he needed to do was to prescribe and say, go take this drug or take that drug, okay? All of that process has now been moved away. You do not need to do it physically again, and I'm sure a lot of us are aware of this already. But even with all of these benefits that brings about accessibility and efficiency and all of that, there are also some challenges, okay? A huge one of them, which affect us in this part of the world, is the digital divide. We talk a lot about telemedicine and the vast opportunities it has, But one of the big challenges we are having is the limitation with regards to internet penetration, and also the ability, or the ability of those, or even the people who need this, to be able to pay for it, to be able to utilize the technology that is layered on it. So that is one big challenge. We also have regulatory and privacy concerns, because Africa is still emerging, is still developing. There is a tendency for us to be exploited. Data can be used for things that ordinarily they should not be used for, to advance certain aspects of medicine in an unethical manner. Okay. Also, there are some clinical limitations, of course. If a patient needs to be physically examined, this cannot be done virtually. Okay, those are some of the limitations of virtual healthcare. But barring all of this limitation, there are vast benefits to virtual healthcare, because again, just borrowing a keyword from the doctors, you can triage. You could actually have only people who need to physically be in the hospital, while others are cared for, okay, from the comfort of their homes. And this would significantly improve what's it called, like we said, the efficiency of care, and also reduce the patient burden that needs to be physically in the hospital. So moving on from that, one of the major technological advancements that I would say is the foundation, is the foundation for the entirety of the integrated care, or the advancement or revolutionization of care we're talking about, the electronic health records. And why is this important? A couple of months ago, I was going past a particular hospital, a teaching hospital, and I went through their records department, and I could see files upon files upon files of patient records. And what crossed my mind was, so it means if this person came to this hospital 3 years ago, and you needed to find out why he came, and maybe he has lost his personal file, chances are you will not find it. So that entire history is lost. It makes it difficult for the doctor to start all over again. For me, it increases the cost of care, and it doesn't make the entire process as efficient as it should be. So what are some of the benefits of electronic health records? Centralized patient information. Okay, with a click of a button, with a unique number or a unique identifier, I can see everything that belongs to Dr. Obey. So Dr. Obey can decide to, and this is me talking about the potential here. Some of them may be relevant or may be practiced currently. Some of them may not. I could go on the system and I could see Dr. Obey's record. And if I am a doctor in Reddington, because we've been able to integrate the entire system, and it's not just unique, which was what Dr. Tinu was talking about, where we need to start working around integration of the electronic health record. And I'll point to how some of those could be done. Dr. Bay could go to Reddington to see a specialist there, and he would not need to go with anything, because they just put in his details and they could see all that another specialist had done, maybe in Ife. Okay, and it just makes the entire process very easy. Of course, healthcare coordination. Okay, imagine that again, I went to see a specialist, and the specialist had finished dealing with me, or has finished treating me, and he needs to move me on to a primary healthcare physician. Okay, it makes the entire process easy, because nobody needs to moving around with files, and it just makes access to information at the tip of our fingers. Now, just think about the possibility that creates. Of course, patient outcome tracking. Okay, it's easy to track patients' outcomes. It's also easy to intervene when things are going out of sync, and it's also easy for healthcare multidisciplinary interaction and like a consultation, because if something is going wrong in a particular place, another specialist could easily see it if he has access to that file, and intervene or guide on what can easily be done. And that's why electronic health record is actually very pivotal to any changes we're going to be seeing in the future as relates to healthcare transformation, especially in Nigeria and the rest of the sub-Saharan African space. Now, what are some of the things that we could do to enhance accessibility and coordination of electronic health records? Because this is very important. One of them is we need to adhere to standards. There needs to be certain standards. And there are a lot of standards that exist, but some of them are quite key. Okay, we need to ensure that the systems that are in use abide by certain global best practices. There must be HL7 compliant. They must allow for interoperability. These are certain basic things that must be there. So why this is important is because I see a lot of teaching hospitals begin to adopt electronic health records. My question is, who is supervising the procurement of this electronic health record? Do they meet this minimum requirement? Do they meet these minimum standards so as to ensure that when we are ready for the interaction or the interfacing of health records across centers, across institutions, it becomes easy? We need to use common data sets, okay? Globally, one of the institutions or bodies that actually is driving this is LONIC. So you know their codes referred to as LONIC codes. So that if I'm requesting for EUC in Nigeria, is the same code that is imputed in Mayo Clinic in the US that is also imputed if you request for EUC in SYNLAB Nigeria. Now, what that does is that from a national surveillance perspective, it allows for easy analysis of data, okay? Making it easy to understand the trends, the shifts in disease patterns, and also see what is happening from a non-communicable disease perspective. The certain maybe demography is seeing an increase in maybe blood glucose level. All of those things become easy to analyze. Currently, all our data are sitting in silos, okay, which is good. It's better than having it in the physical copies, like I explained before, okay? But we need to start thinking of how to integrate our data, okay? And this is where all of these come into play. Of course, moving on from that, implementation of APIs. Of course, when you want to connect these systems, you need APIs to connect them. Participating in health information exchanges, consent management. Now, this is very important, okay? I remember during COVID, and I was very proud of my team when this happened. And the Lagos state government said, oh, we need to audit your data. And of course, it is the government. And of course, I should obey the government. And they say, we need everybody's data to see what has been done. And we said, we need to get consent from the patient before we're able to share their data. And of course, the person who was auditing was quite amazed and he was happy because he also was proud of the fact that I would not give his data to anybody without his consent. Okay, but we need regulation or regulatory agencies to be able to enforce this. All right. Note, you come to do a test, even if you want your husband to pick up the result for you, you must give him consent. Okay, because the thing with digital is that sharing is easy. With sharing being easy, it becomes easy for people to just penetrate your system or use your data to do whatever they want without your consent, okay? Now, the challenge with that is that not everybody is as honest as maybe SYNLAB. So people could use the data for unethical practices, which may directly harm you or harm another civilization or harm another society. Of course, training and education. A big drawback to the implementation of electronic health records, especially in the public sector, is training, the gap in training, the gap in education. Okay, there's a need for constant retraining. In fact, a huge investment in training and education. And I think we need to find a way to introduce this maybe as a non-credit course, even to our curriculum for maybe electronic medical record students, or even for basic health sciences, and even for for medical sciences courses in school, just so that people are aware. So you don't come out of school and you're seeing all of this for the first time, and you do not really know how to use them or how to manage them. Of course, testing and certification, I mentioned this goes in line with the adherence to standards. There is a deep need for us to ensure that the systems that will be deployed, that will be used, okay, meet certain basic standards and are certified for use within the country. Let us not, because we want to advance electronic health medical records or electronic health record, open the whole door for everybody to come in. And then when we want to make use of the data, it becomes difficult to leverage on the data. There is a need for a system to meet certain standards. Wrapping up, of course, there needs to be clear legal framework. I think that I've talked about that already. And what are the use cases? And I'm wrapping up with this. What are use cases for electronic health records to facilitate real-time informed decision-making in patient care? One is in clinical decision support systems. Imagine Dr. Obey is about to make a prescription for a drug for someone who maybe is diabetic or someone who has a bacterial infection and wants to prescribe an antibiotic. And immediately he imputes the antibiotic to be prescribed into the system. The system, because it has all the records of that patient, prompts Dr. Obey that this person is reacting to XYZ. Now, that immediately prevents, or first of all, it saves costs. You won't need to do trial and error. Secondly, it prevents, or how I put it, it reduces the irritation a patient needs to go through just because he's trying to access care. That is one thing that electronic health records can do because of the interconnection that you're able to leverage from it. Second is real-time lab results and imaging. And this way, of course, this is already ubiquitous in Lagos at least, and most major cities where you don't need to visit the lab a second time to get results. Radiologists do not need to get a physical film to be able to access images again. Of course, health information exchanges, I've talked a lot about this, okay? Where continuous care is possible, because a specialist has seen someone, he doesn't need to start sending an email or making a call to someone else. Because your code is tied to you, you can take that code, take it to your primary healthcare physician, he logs in, he sees the notes that have been made by the specialist, and then you move on with care from there. Of course, remote monitoring of patients and all of that. Now, all of these are things that are possible, but all of these can only rest on the foundation of privacy and security. And why is this possible? This is possible, this is relevant, this is important because, like I'd mentioned, if there is no privacy, data can be used to do so many things that, of course, are not ethical. And how do we achieve this? Encryption of data, encryption of healthcare technology. There needs to be a level of encryption, minimum level of encryption that is allowed. Access controls are needed. And of course, patient data right management needs to be fostered. Having said this, what is the future of health technology? I've mentioned it before. We're already in the future, if I would say, because a lot of this aspect, I imagine, big data I can't imagine what the next 3 years would be with regards to healthcare, because we are mining data from years and leveraging on the knowledge from several decades to be able to, provide faster resolutions to care and all of that. So this is where I will stop for now. And I want to say thank you to the team for having me. Thank you very much.
Right. Thank you so very much. We appreciate your time. Please, participants on the call this afternoon, please drop your question. We're gradually moving to the end of this webinar. Please drop your question. Again, want to say thank you to our very own Kenneth Okoli for your presentation. I mean, you had extensively talked about virtual healthcare. I mean, you mentioned, what we have been able to achieve as a country. And of course, again, you have also made us realize that we still have a lot to do. And of course, that is the future we should all be looking towards. You talk extensively on centralized patient information. And of course, you listed all the things that we need to do. I may not want to go over them one by one again, but we really want to say a very big thank you to you and everyone who has presented this afternoon. So thank you so very much. Right about now, we go to our question session. We have 3 questions already. For everyone who has given the comments, you've also shared your insights. We'll say thank you. We will not be able to read through all of them, but of course, we'll take the questions that we'll have. The first question is, how can healthcare worker in diaspora be of value to all that we have discussed? So I want to give Dr. Ali 2 minutes to respond to this, and of course, again, Kenneth Okoli 2 minutes to respond to this. How can healthcare worker in diaspora be of value to all the conversation we've had this afternoon?
Afolabi, I believe that with all we have said and with the adoption of technology, with all we've preached so far, especially from Kenneth's presentation, I feel like healthcare workers in the diaspora have a huge role to play in terms of supporting us with their knowledge, the technical knowledge and expertise that they have gained from working, from training and working over there. So, for example, telemedicine services, with specialists, healthcare workers in the diaspora can help us consult via telemedicine, help us review cases on, for example, in cancer cases, you have tumor boards, and people who are professionals in oncology from any part of the world can sit on tumor boards and help us review those cases. Consultation, specialist consults, rare specialists that we can't even find over here can support us that way. By the time we get to the level where we're adopting high level technology, even our ICUs in Nigeria here can be monitored by nursing personnel that are outside of the country, through technology as well. The healthcare personnel in diaspora have a huge role to play, and they don't necessarily have to come back when they've made enough money and it's time to retire. They can come back to Nigeria, but they don't necessarily have to come back at this point. They can support us via technology, and to go a long way in improving our healthcare indices in Nigeria. Thank you.
Right. Thank you so very much. Kenneth Okoli, your thoughts on the question?
Yeah, I think Dr. Ali has actually done well in answering that question. I will just maybe go into slight detail within my short time just on what can be done. So yes, something that those in diaspora can really do is in providing those access to consultation, because clearly we have more specialists outside of the country at the moment than we have internally. But how can we operationalize this as a question? So I see a situation where we can actually run it as a pilot, where a teaching hospital or even a mega private hospital can set up a virtual center where specialists offer consultations in a room, okay? And this is like a model that is being run. And we can say, oh, you want to have a neurosurgeon for pediatrics, and he needs to do XYZ. And the room or the center is purpose-built for virtual consultation and maybe some form of what's it called now? Evaluation of the patient. I think is going to go a long way in improving the outcomes that we see in country. Of course, it's going to cost some money, but I think it's going to be cheaper than traveling abroad. And of course, when someone knows that there's a solution locally, there's an added motivation to actually want to source for whatever it's going to cost to actually get that solution rather than just being hopeless. So that's something.
Thank you so very much. This next question goes to you because I think you discussed extensively on this. What factors do you consider when choosing electronic medical record system? And of course, as an adjunct to that question, it's is it possible for telemedicine to be implemented in a government hospital? particularly teaching hospitals in Nigeria? And if yes, what are the procedural level that is expected before this can be implemented?
Okay, the second question is quite, like we say, it's quite deep. Nothing that's impossible. It's very possible to implement it. First of all, there's a willingness that is required. I think that's the first thing from the government, because these things are not, like I would say, they're not rocket science, okay? If there's a willingness from government, you set up a building and you design it in such a way that it meets the minimum infrastructural level to do virtual consultations, okay? That's it. It requires money, it requires willingness, and it requires a desire to run things excellently. It's not more than that, okay? I won't go into the fine details. What are the things to look out for in getting an electronic medical record? Like I said, there are clear guidelines for this, okay? First of all, you shouldn't get an electronic medical record that does not have HL7 what's it called? Operationalization, or that is not able to integrate with other systems using HL7, because getting that is literally, I'm sorry for lack of better words, useless, okay? Because it means that nothing can integrate into that system, okay? Also, whatever system you're using must be able to at least accept APIs, okay? So quite frankly, if you go online, there's a schedule on the minimum, there's a checklist on the minimum requirement an electronic medical record system should meet from an international perspective, okay, so that it is able to fulfill the use that you want from it, both now and in the future. And I really am dwelling a lot on this because I have actually seen electronic medical records being used in hospitals that do not meet any of these requirements, okay? In fact, some of them are just advanced Excel, okay? But we call them electronic medical record. The truth of the matter is that while they are good, we are leveraging on what is available, but we must be preparing to move away from that to something that would help us really leverage the information and the data we are collecting.
Right. Thank you so very much for your question. Again, please, as we're rounding up, let me remind us that a short questionnaire will be sent to us. Please ensure you fill the form. At least let's start our learning from this presentation. Let's start it from here. Right. Dr. Tinuola, there is a question for you, ma'am. How do we activate or operationalize all the things that we have discussed here today to reflect, in our healthcare system?
Thank you for that question. That's a big question. How do we activate everything we've learned here today? I think people just need to be open. Once we're open to change and not resistant to change, I find in my experience, a lot of medical personnel are resistant to change. Change, the fear of the unknown. But change is not necessarily a bad thing. So I think if we're open to change as policymakers, open to change as healthcare providers, delivery providers, open to change as patients, then we don't reject everything that comes along, and we actually analyze it to see what's the benefit. And if we do some type of analysis and we see that the benefit outweighs the problems, and remember, there are so many new things. I mean, I was really interested in Dr. Ali's presentation when you said we should all try and learn more on AI and blockchain and all the new technologies. If we're not closed off from that, then the sky's the limit. We can have people come from the diaspora. We can just imbibe an attitude of innovation, collaboration, innovation, and that way we can deploy every single thing that we've said here today. I think that's the short answer.
Right. Thank you very much for that. Yes, we're rounding up. Please, the feedback questionnaire will be displayed on the screen, on your screen. Kindly endeavor, take time to please to fill it up. It won't take more than 1 or 2 minutes. We'll have 1 or 2 more questions. But before we go to that, This presentation is available on YouTube. Yes, it has been displayed. Just click and scroll down, and please let's endeavor to do this. This presentation is available on YouTube. Perhaps you missed any of the section, or you would just like to listen again. Endeavor to go on YouTube and listen to it. And of course, would also appreciate if you subscribe. This is at no cost to you. You could also follow us at SynLab on any of our social media platform, on YouTube, on Facebook, on Instagram, on LinkedIn. We'll appreciate you do that. The last, okay, not a question per se. I think someone is throwing an encouragement to us, I mean, particularly the presenter today. He said, would you recommend this kind of section be incorporated or carried out at the undergraduate level, seeing that this forms the foundation of patient care? Absolutely, yes. I mean, for me, one of the things that helped me was someone, within the corporate sector who taught me as a 500 level medical student. I mean, it brings a separate dimension to the conversation, and you see things beyond the paper and the book. You could see things in real life. So I think it's an encouragement to our presenter. You may want to take up a short teaching session, especially Dr. Tinwola, who has asserted to the fact that one of the things she likes to do is to mentor the young one. So as we're rounding up again, please, you can follow us on YouTube, on Facebook, on Instagram, and LinkedIn. I want to particularly say thank you to everyone who has taken time to participate in this webinar. I do hope that our knowledge has increased, and I do hope that within our own space, we have learned one or two things that we can operationalize, and I also want to believe that the next session, we're also going to be together to participate in this. I am Afolabi Obe. I want to say thank you to all of us.
Thank you.
Yeah, thank you.
Thank you.
Thank you.